Much of physical therapy occurs in the patient's home, where they are unsupervised. This proves to be a challenge for most patients, especially those with cerebral palsy, hypotonia, and hypertonia. We set out to tackle these issues by creating an AI-driven closed-loop physical therapy assistant to help the patients with doing their exercises at home. With our first phase of iTherapy, we created a ball-throwing physical therapy robot that would first roll the ball to the patient. The patient would then kick it, and the robot would retrieve the ball. With iTherapy 2.0, we created a humanoid physical therapy robot that would demonstrate the exercise for the patient, and then it would record the exercise. We also created an app for both the patient and the therapist. With iTherapy 3.0, we created a pose-detecting physical therapy assistant. We use pose detection to analyze the patient's exercises and give them feedback on what they should fix. In our current phase, iTherapy 4.0, we created an AI-driven closed-loop physical therapy assistant that incorporates real-time feedback with the therapist.
The closed-loop process is simple. The therapist takes control of the patient's screen via Zoom and begins to run the program. The therapist then types in a specific pose, and the patient then does that pose. When the pose is done, the therapist and the patient receive instant feedback from the AI-driven pose detection program. If the patient does it right on the therapist can move on. Or if the patient does the pose incorrectly, the therapist and the patient will receive instant corrections on the pose, such as move your left hand down or move your right arm up. The closed-loop system also involves documented sessions. The Send Email feature sends the therapist a picture of all the poses done in a session, along with corrections if necessary. With the distance treatment age being upon us, there has been a demand for physical therapy while staying at home. There is also a need for patients that do not have the means to get to a physical therapy appointment. This type of closed-loop therapy solves those needs and enhances the therapist's ability to treat patients effectively. It has not been done in the physical therapy field before, and our project solves a crucial demand. Thank you.